Good afternoon. My name's Steve Pelcher, and I'm with Peraton, and I'm going to introduce a use case with our partners here from Qvera, Epic, and Baxter. This use case is about cardiac care and tribal health and interoperability. So we're going to start with introducing the patient. His name is Anthony, and Anthony is a veteran and an American Indian. He spends the majority of his time in the tribal community, and within that tribal community he has a primary care physician who uses the Indian health services. So he uses the RPMS system, and so all of the data is collected through RPMS. He's also a veteran, obviously, which is what I just said. Sorry, he's also a veteran who also goes to the local VA hospital, and the VA hospital uses a system called Vista. Now, both of these systems have about 20 years old. They have a long history, they have a lot of data, but they're also siloed information. They have fractured data, and a lot of that data is used with business logic. It's infused with business logic that's hard to get out. So one of the things that we are challenged with is getting all of this data together so that we can pass that information to everybody and be able to share it. So Health Concourse is a tool that we use to get to the next level of health IT, which we refer to as care without boundaries. And what that means is we have data interoperability, data that's shared through FHIR, has the FHIR base. Knowledge interoperability, that means that we have tools that we can use with that, which is CDS hooks and BPM+. We have process interoperability. And so those three things really kind of refer to as care without boundaries. Now let me share a little bit about Anthony's medical history. And I'm going to show you the screen up here. And this particular screen is RPMS. It's hard to read, I understand. But there's a lot of information back here that is historical and is really important for the hospitals and everybody else to understand. So our patient Anthony, as you can see, it would go in for mild cases like coughs and pharyngitis and things like that. But he's also got essential hypertension and some of those symptoms. So I just point out some of the details along that. Hypertension. And then with a little bit more complex issues, he goes to the local VA hospital. And that VA hospital uses CPRS, and his information is covered here, and I can point out some of the things. He's got also type 2 diabetes, which they're tracking. So you'll see that this is important information to be passed along. Now, what we're doing with Health Concourse is to gather that information, aggregate that information, and standardize it. So as I walk through this, the 1, 2, 3, 4, we're going to pull that information from those systems of record, and they're going to aggregate it and pull it into a FHIR format. So that's where we do the transform. It could be any format. It could be CDS. It could be XML, JSON, HL7. We can bring anything in, and it'll be transformed into a format of FHIR. We're using Smile CDR as our base. And then we start to standardize this information, and we identify things like SNOMED or LOINC codes and terminologies and ontologies such as that. And then we'll enrich that data, enrich it using things like natural language processing and CDS hooks and FHIR conformance and validation that allows us to give you a better value for, more information for that information, for that data. All right, so now we've collected all the information, we've standardized it, we've enriched it, and we're ready to share that information. So it's all in FHIR. And let me share a little bit of what that looks like after we've done this ingestion. Here's Anthony's information, and you can see on the screen here that we have two sources of data that were pulled in. resource types from fire are all identified as conditions, encounters, allergies, observations. So they're all listed out here. And I'm going to just pick one to drill down in under conditions to show you that we've brought in the information from those two sources, RPMS and the VISTA. And the ones we had pointed out earlier were essential hypertension from RPMS and type 2 diabetes from VISTA. And both of those are here. And just to drill down just a little bit further, this fire icon will drill in, and you can see that this information, we have applied security labels, and we also have tagged it with the SNOMED codes and identified where the information came from, the provenance of that information. So you can see all of that information can get passed along. Okay, so now we've identified, we've aggregated that data, and it's ready to be passed along. Now, to continue our story with Anthony, Anthony is feeling a little chest pain and wanted to go see his primary doctor, and his primary doctor said that he's going to refer him to another cardiac office. That cardiac office is not in VISTA, it's not in the VA, and it's not in RPMS, so it's going to be out in network, and so that information is going to be important to pass. So here we're going to pass that information to both Epic and to the doctor's cardiac office with Qvera. And here we'll pass it to Brandon from Qvera.
I'm Brandon Wayman with Qvera. I'm an interface engineer here at Qvera Interface Engine. So as we talked about, Anthony is having chest pain, has come to the cardiologist office, which we are playing the role of the cardiologist in this use case. And using the Peraton Health Concourse Fire API, we're able to pull in the data that you just saw on Peraton's system. We kind of point out that we have the hypertension here, we have type 2. He has quite the extensive history. This has been there quite a bit. We actually can get the location of where it came from as well, as you can see here. Along with that, we also get medications, allergies, encounters, and we also have a list of observations, quite the long list. So we've got quite the history for Anthony to show what's going on with him. At this point, because he's come in with chest pain and his EKG is abnormal, he's also had a prior heart attack. He's got swelling in his lower extremities. He's got increasing fatigue. And he's also having difficulty in breathing, especially at night. So with that, we go ahead and order an echocardiogram. That echocardiogram is performed, and the modality is then able to send the DICOM file over to the Qvera interface engine. Now, the struggle here is now I need to get this data in front of the cardiologist in his EMR. So both the history from Peraton as well as this DICOM, the cardiologist EMR cannot accept. So what we do is we go ahead and convert the JSON file into HL7 and send it into the EMR. For the DICOM, we open that up and we get the attributes from it as well as some of the images, and we send that into the cardiologist EMR. This now gives the cardiologist all the information he needs to be able to make a diagnosis. Anthony unfortunately has congestive heart failure with reduced ejection fraction, and our cardiologist has gone ahead and written up quite a bit about what he's found and what we need to do. We need to send him to the cath lab at the hospital for a coronary intervention. So we'll go ahead and refer him to there. But before we do that, we're going to go ahead and get the data for the hospital to help this transition. We do this by going back into the EMR and getting the documentation from the cardiologist. We also pull images from the echocardiogram, as well as have some results in here from the EKG. So we are able to put this together, put it in a report, put it in a PDF format, and then we make it available with the cross-community access, which the hospital Epic will be able to pull when Anthony is then in the hospital. We'll now continue Anthony's story at the cath lab in the hospital. I'll turn it over to Epic.
Hi everyone, this is Rachel from Epic. I'm going to go ahead and show you what happens when Anthony shows up to the hospital for that procedure. Starting with the information that we get from Qvera, we're going to open up the media tab where we have the PDF from Qvera with the text as well as that imaging that we just talked about. This is going to be stored in the patient's chart permanently, so we can always access that if we need to. Then we can go into that reconcile outside information tab where we can actually see those discrete data points that we just talked about for the patient's problem list and history. So here we've got that hypertension and type 2 diabetes. Now, Anthony is not feeling well. He has become hemodynamically unstable, so we're going to send him to the ICU for treatment. We'll have Baxter talk next about that.
I'm Tom from Baxter. So as Anthony transitions to the ICU, we find that his care team has identified indicators of acute kidney injury and initiates renal replacement therapy. So continuous renal replacement therapy on the Baxter Prismax starts up, and after the treatment has begun, the TrueView Connect on this Prismax device sends information directly to Epic over the hospital's wireless network using HL7 2.5 and is going to capture over 100 data points every minute for the duration of the treatment. This is expected to unlock 16 minutes per hour of nursing time, going back and forth and doing manual transcription, as well as reducing errors in potential manual transcription. The TrueView Connect is accessible via IT to troubleshoot the individual connections without actually impacting the medical device settings or any of the patient care. So the actual background connectivity can be maintained without impacting the patient's treatment itself. So with this information coming straight back to the EMR, we'll pass it back to Epic we can make more informed decisions with the doctors.
So as we mentioned here, there is a good opportunity for efficiency gain with this type of device integration. We're going to see that efficiency gain here in the flow sheets activity. First, we would go in and associate the device via the associate device activity. In this case, the Baxter device is already associated, but this is important because it makes sure that we have the correct device on the correct patient. This ensures that we also get the correct data onto Anthony instead of going to some other one. Once we're ready to actually file and review that data, we can go to the data validate activity here. We can choose from different intervals, and when we are looking in this activity, we would see data from the CRRT device. That would then file to the chart and be permanently on the patient's record. The other device integration that we're going to show today is infusion pump integration. In Anthony's case, he does have type 2 diabetes, so we've already placed an order for insulin. We're going to go ahead and administer that to make sure that his glucose levels stay in check. We're going to start by actually administering the medication the same way you would without integration, so we're going to start by scanning the patient. I don't have a physical patient here, so I'm going to go ahead and just scan a barcode to get us started. This makes sure we have the right patient. Then we're going to go ahead and scan the actual insulin order and make sure we've got the correct order. That's then going to prompt us to scan the pump. Scanning the pump is really important because it connects the pump to Anthony and to Anthony's insulin order. So as the nurse, I'm going to make sure that that pump is actually ready to receive programming. So I'm going to go over to it, make sure I have the right care area selected, and that the barcode is displaying. Normally I would go over to the pump and scan it, but of course I can't quite reach over there, so I'm going to go ahead and scan my test barcode, and that is now associating the pump with this specific patient and order. While I'm here, I'm going to confirm that all of the correct order information is there, review any admin instructions, and get ready to actually transmit the order to the pump. When I'm ready to do that, I'm going to go to the bottom right-hand corner and hit Send Details. I'm going to go ahead and do that and then hand it over to Baxter to show you what's going on the pump.
Hi, I'm Uma from Baxter. So here we are seeing the scanning of the pump, the patient, and the syringe, which proves the 5 rights of medication administration, which is right patient, right pump, right dose, right medication, and right time and right route. So now I receive the order on the pump. So I accept the order. Then I have to confirm the syringe that is loaded on the pump, which is the BD 20 ml, which displays. And so I press OK and confirm. And I'm saying no to prime. And now confirm all the parameters and accepting the program. And then press run to start the pump. So now the infusion is started. So what we saw is like the Baxter Novum IQ syringe pump along with the Baxter IQ-E. It supports the latest communication trends, and also it supports auto programming, which reduces the clinician entry errors, and also supports auto documentation, which reduces the the clinician time taken for recording the patient data, and also at the same time it improves the efficiency and timeliness and storing of the patient health data. So now that the patient data flows back to Epic, then the Epic can decide whether the infusion program is running correctly on the pump, and they can make a timely decision on the program. So now going back to Epic.
So, as we mentioned here, there are some great efficiency gains here, and nurses are going to realize those most in the Infusion Verify activity. The Infusion Verify activity is going to record everything that is happening on the pump when it happens. This means that nurses don't have to remember what time they push the button. They don't have to worry about calculating volume. All of that will be automated and come here. So we're going to go ahead and go to now to make sure we've got the most recent data, and you can see here exactly what's happened on the pump as well as the volume. When I'm ready to accept and file this to the chart, I'll hit accept. That will permanently add it to the patient's chart. Now, Anthony has had a miraculous recovery and is ready to go home. We're going to discharge him from the ICU and talk about his post-acute care.
So as Anthony has been discharged from the hospital, he's come back to the cardiologist now. We've taken another echocardiogram as well as an EKG and found it to be normal, and he's recovered from that and doing well. His kidney function is also returned to baseline, so he's doing well on that. We will now just do annual follow-ups with Anthony to make sure he's staying good. He's now working with his PCP for his medications and managing those types of things with him. As you can see with this use case, what we've been able to do is by using FHIR, Peraton has been able to share records that are normally siloed and not able to get, especially together. We're able to get that together using the HL7 FHIR spec. Here at the cardiologist's office, we're able to use DICOM to get images and send those where we need to get them put them in for referral and help with that. We also use cross-community access for Epic to be able to get that referral at the hospital level. And then with the pumps, we're using HL7 for the CRRT machine to get those vitals every minute to help the documentation and reduce the amount of documentation clinicians and nurses have to do. And then for the pump, they were using HL7 to not only send the order to the pump to improve accuracy, but also send what was sending back for auto documentation to, again, reduce the time that clinicians and nurses are taking to do that. By doing this, we really have got care without boundaries. We have increased efficiency for the clinician staff. We've increased the patient outcome, and really, improved the time it took to get him diagnosed as well as treated. So, with that, thank you for very much.